conversation on Ma Cultural Week. But even as we get to that, let's take a look at other stories making headlines. And let's talk about matters of health and social health authority, which replaced the former National Health Insurance Fund, is proving to be a challenge to some Kenyans, despite the government's assurance that it will deliver healthcare to all Kenyans. Just how do unemployed people pay their contributions, and what happens in case of delays in the approval of payment? Well, on the flip side, there is a section of Kenyans who are already enjoying the services under the Social Health Authority. Tonight, Clement Masombo looks at the story of cancer patients who have interacted with SHA.
As the government continues with the full implementation of the Social Health Authority, SHA, which has three funds under it: the Primary Healthcare Fund, PHIF, the Social Health Insurance Fund, SHIF, and the Emergency, Chronic and Critical Illness Fund, it is evident that the new health system, which replaced the former National Health Insurance Fund, NHIF, is yet to hit the road running. A visit to hospitals in various parts of the country depicted a picture of unhappy Kenyans who are desperate for services. Still, a majority of them cannot access the much-needed services. At the Nyeri County Referral Hospital, we meet Ann Wanjiru, whose mother is a cancer patient. She says since the NHIF stopped working, her family has spent over 90,000 on medical services alone.
Nimekaribia kulemewa juu hata kama ni ng'ombe tumeuza kuku. Na kama tungekuwa tunatumia hiyo SHA, pengine hatungefika hapo. Tungetaka tuelimishwe, juu kama ningekuwa najua, ningekuwa nimeingia. Juu nimekuja kujua wakati ukiisha.
Like many Kenyans, Wanjiru didn't know how to register nor make payments under the new Social Health Authority, which hindered them from enjoying the services.
Tuliregister hiyo NHIF kitambo, lakini wakati mlikuja mkabadilisha, hatukuwa tunajua njia ya kubadilisha. Sasa tulijua juzi, tukabadilisha, hatukuwa tumetumia hata nini, juu tuko na wiki mbili tangu tubadilishe. Juu hatukuwa tunajua venye kunaenda, tulikuwa tunaona kaa tu ni kuchezewa tu.
In Nakuru County, David Mwaura, another cancer patient who has been accessing oncology services since August, also suffered similar challenges. He is, however, hopeful that if the challenges, which he refers to as teething problems, are addressed, the new system will be far better compared to the former NHIF.
To log in after the 20 to 25 minutes hapo ndipo message ya kulog in iliingia na nikakuwa nitatengenezwa leo, nitawekwa dawa leo, that is.
Their tales, however, differ from that of Beatrice Mudhoni, another cancer patient from Lanet in Nakuru County. To her, SHA came with blessings. She has not encountered any challenge from the new system since it was introduced.
Hii SHA, unakuja zinatumwa asubuhi na unaingia dawa.
According to Dr. Samuel Wanjara, the Deputy Medical Superintendent at the Nakuru County Referral Hospital, they have had a seamless adoption of the new system.
Oncology patients who are now able to access all services under SHA, and we have not had any challenges with pre-authorizations.
Clement Masombo, KTN News.
Two suspects linked to the murder of Wells Fargo company human resources